Tests last night to 8 p.m. There were 139,182 tests. Just want to thank everybody who went out and got tested, because the work that you do in going out and getting tested certainly empowers our doctors and our health staff to make the decisions on what we can and can't do as we move forward. Locally acquired cases to 8 p.m. last night were 1,063 cases. So 1,063 cases. There was one overseas case. Just want to highlight the fact that the community in Western Sydney and Southwest Sydney really are doing a very, very good job in terms of being vaccinated and just following the stay-at-home rules that have been in place. And I just make the point that the cases to 8 p.m. last night in Western Sydney were 220. I compare that back to 2 weeks. I picked the 11th of September as a date, and what I found was that there were 444 cases on the 11th of September. So to drop to 220 is actually a really positive indicator, and actually it's roughly consistent. The day after that 444 was 402 cases. So to drop to 220 is very good. Southwest Sydney last night was up to 294 cases, and again back in the 11th of September was 490. So again, to the people of Southwest Sydney and Western Sydney, you're doing a great job getting vaccinated, complying with our stay-at-home rules, and you're making a difference to all of us. So thank you so much. Children, of course, 12 to 15, we opened up the vaccination opportunities now just over 9-10 days ago, and already 28% of children 12 to 15 are vaccinated. It's just amazing. So thank you to all the young people out there. We had a young person here the day before yesterday who was talking about the importance of vaccination, and I think all of her friends, her cohort across the state, are all doing that and getting out and getting vaccinated. And Dr. Matt Amara, the Chief Paediatrician, will make some comments about that. In regard to the current health impacts, I'll ask Dr. Gale to give the details of how many people in hospital and how many people in ICU and so on. But I do just want to say that, very sadly, we had 6 more people pass away to 8 p.m. last night. There were 4 females and 2 males, 4 gentlemen and 4 ladies and 2 gentlemen, and they ranged in ages from 50 to 90, and obviously that's very sad for their families and for their friends. So again, my condolences on behalf of the government, but also on behalf of the health system, and I'm sure on behalf of our whole community, to each and every one of you who would be suffering that sadness that comes with one of our close friends or family members passing away. There have been, of course, stay-at-home lockdown arrangements in a number of regional areas. I just want to reiterate what was done yesterday, and that was that followed the press conferences, I recollect, yesterday. So yesterday, the areas that came out of the lockdown arrangements were Brewarrina, Gilgandra, Lismore and Albury. And there was also an announcement that Narromine will come out, subject to there being no other major problems between now and Saturday. So the folks of Narromine can know that if there are no major issues in their area, by Saturday night, midnight, they will also come out of that arrangement. And the other good news that I'm really pleased to be saying today, there's been no more major issues in either Orange or Glen Innes. So both Orange and Glen Innes will come out of the current arrangements, the lockdown arrangements. There'll still be the standard restrictions, of course, it's the precautionary measures, but they'll be out and back to much more normal life as of midnight tonight. I'm going to ask Dr. Gale to update us on some of the other medical issues, and also then Dr. Matt Amara, to talk to us a little bit more about the young people. And I think you might have something to say also just on the surge workforce that's people coming forward to put their names down and be able to assist us if needed, the doctors, the nurses, the allied health staff. So I'll start with Dr. Gale first, please.